The 78th World Health Assembly, concluding its sessions this past week, has delivered several pivotal resolutions. These decisions aim to reshape global health priorities and responses. Member states gathered with a sense of urgency. They addressed pressing issues impacting millions worldwide. The outcomes from Geneva signal a renewed commitment to tackling both long-standing and emerging health challenges. The Assembly's deliberations underscored the interconnectedness of health systems and the critical need for international cooperation, especially in an era of constrained resources and increasing health threats. This annual meeting serves as a crucial forum for global health governance. A landmark resolution has officially declared rare diseases a global health priority. This is a significant step. It acknowledges the more than 300 million people affected by such conditions across the globe. The resolution champions the integration of rare diseases into national health planning frameworks. It also seeks to substantially improve diagnosis and care pathways for patients. Furthermore, the measure promotes the development of inclusive policies. It aims to accelerate innovation and ensure more equitable access to affordable treatments. The World Health Organization has been mandated to develop a comprehensive 10-year global action plan to guide these efforts and bring tangible relief to those affected. The Assembly also confronted a looming global health financing emergency. A critical resolution was passed. It aims to strengthen worldwide health financing mechanisms for universal health coverage. This comes amid concerns of a potential 40% reduction in external aid projected for 2025. The resolution calls for decisive actions. These include bolstering domestic budgets dedicated to health. It also stresses improving public financial management to maximize the impact of available funds. The WHO itself will enhance its technical core functions to better support member states in navigating these complex financial landscapes and ensuring health services remain accessible to all. Other significant resolutions included a commitment to enhance national capacities for developing public health guidance. This guidance must be based on high-quality scientific evidence. The WHO will maintain rigorous standards in its normative products and support member states in this endeavor. Global commitment to eradicate guinea worm disease was strongly reaffirmed. Only 15 human cases were reported in 2024. The strategy involves an integrated approach, targeting eradication by 2030. Additionally, skin diseases were recognized as a global public health priority, with a new resolution focusing on strengthening financing and access to medicines. Finally, Indonesia was formally reassigned from the WHO Southeast Asia region to the Western Pacific region. International conflicts continue to cast a long shadow, bringing devastating humanitarian consequences. The war in Ukraine persists with unrelenting intensity. Recent reports from the past week indicate that at least 12 people died as Russia continued its aerial assault on Ukrainian cities. These attacks cause widespread destruction and instill fear among the civilian population. A coordinated Russian strike on Kyiv has reportedly threatened a potential prisoner swap. This development adds another layer of complexity to the already fraught situation. The international community watches with grave concern as the conflict grinds on, with no immediate end in sight. The human cost of this war continues to climb daily. The humanitarian impact in Ukraine is profound and multifaceted. Millions have been displaced from their homes. They seek safety either in other parts of Ukraine or in neighboring countries. Access to basic necessities, including food, water, and medical care, remains severely compromised in many areas directly affected by the fighting. The constant threat of shelling and missile strikes has a devastating psychological toll on civilians, particularly children. Infrastructure damage is extensive, crippling essential services and making daily life a struggle for survival. Aid organizations are working tirelessly on the ground. However, the scale of the crisis presents enormous challenges to their efforts. Meanwhile, the Gaza crisis has reached a critical juncture. The United Nations has issued stark warnings of an impending famine as the trickle of aid entering the besieged territory proves woefully insufficient to meet the overwhelming needs of the population. For months, civilians in Gaza have endured dire conditions. These include severe shortages of food, clean water, and medical supplies. The health system, already fragile before the latest escalation, is now on the verge of complete collapse. International calls for unimpeded humanitarian access have grown louder. Yet, the situation on the ground remains desperate for hundreds of thousands of Palestinians trapped in the conflict zone. The World Health Assembly recently noted a comprehensive report from the WHO. This report detailed the organization's humanitarian response in the occupied Palestinian territory and the occupied Syrian Golan between January 2024 and February 2025. Member states expressed profound concern over Gaza's rapidly deteriorating health system. They highlighted forced displacement, severe overcrowding, and poor sanitation as critical issues. Attacks on health facilities were also condemned. A decision was adopted to continue reporting on the health conditions. Support for the Palestinian and Syrian health systems will also continue, with a particular focus on addressing food insecurity and acute malnutrition in Gaza. On the Canadian political front, key leaders have been addressing their respective parties. They are outlining priorities as Parliament prepares to resume its sessions. Prime Minister Mark Carney delivered a speech to his members of Parliament. He highlighted recent election results and set the tone for the government's agenda moving forward. These addresses are crucial moments. They offer insights into the governing party's strategies and legislative focus for the upcoming parliamentary term. The Prime Minister likely emphasized areas where his government intends to make significant progress. He would also be rallying his caucus for the challenges ahead in a dynamic political landscape. Simultaneously, Conservative leader Pierre Poilievre also spoke to his MPs. His speech would have undoubtedly focused on the Conservative Party's perspective on the nation's challenges. He would have outlined their priorities for holding the government to account. Such speeches typically critique the government's performance. They also present the opposition's alternative vision for the country. Mr. Poilievre would have aimed to galvanize his MPs. He would encourage them to be a strong and effective opposition force when Parliament returns on Monday. The contrasting messages from the party leaders set the stage for robust debates and political maneuvering in the weeks and months to come. In international economic news, the G7 finance meeting concluded this past week in the picturesque setting of Banff, Alberta. Finance ministers and central bank governors from the world's leading advanced economies gathered. They discussed a range of pressing global economic issues. These meetings are vital for coordinating policy responses to shared challenges. They also help to foster stability in the global financial system. The discussions in Banff would have covered topics such as inflation, economic growth prospects, and geopolitical risks impacting the global economy. The outcomes of such meetings can have far-reaching implications for international economic cooperation. While specific detailed outcomes from the Banff meeting are often released progressively, the discussions invariably touch upon the need for resilient economic systems. Given the earlier focus at the World Health Assembly on global health financing, it is plausible that the G7 ministers also considered the broader implications of financial stability for global development and crisis preparedness. Strategies to enhance domestic resource mobilization and improve the efficiency of public spending are common themes in these high-level financial discussions. The G7 nations play a significant role in shaping global economic policy. Their consensus, or lack thereof, can influence market sentiment and policy directions worldwide. The world of arts and culture experienced an unexpected disruption. The final day of the prestigious Cannes Film Festival was affected by a significant power outage. This outage occurred in southern France. The festival, a global showcase for cinematic excellence, attracts filmmakers, celebrities, and industry professionals from around the world. A power cut on such a crucial day, likely impacting final screenings or award ceremony preparations, would have caused considerable logistical challenges. Such events rely heavily on electricity for everything from projection to security and communications. The organizers would have faced a scramble to manage the situation effectively. An interruption of this nature at a high-profile international event like Cannes underscores the vulnerabilities that can impact even the most glamorous occasions. The final day of the festival is typically a culmination of nearly 2 weeks of film premieres, networking, and deal-making. It is when major awards like the Palme d'Or are often announced or presented. While the full extent of the disruption was not immediately detailed in early reports, it undoubtedly created a memorable if inconvenient moment for attendees and organizers alike. These incidents serve as a reminder of the complex logistics involved in staging large-scale international gatherings and the unexpected hurdles that can arise. However, the week also brought news of remarkable human spirit and endurance. 2 men from Calgary, Alberta, successfully completed an extraordinary feat of athleticism and philanthropy. They ran 10 marathons in just 10 days, traversing all 10 Canadian provinces. This incredible challenge was undertaken with a significant charitable goal in mind. Their journey was not just a test of physical and mental stamina, but also a powerful demonstration of commitment to a cause greater than themselves. Such endeavors often capture public imagination. They inspire others to push their own boundaries and to contribute to their communities in meaningful ways. The determined duo aimed to raise $1 million through their cross-country marathon effort. The funds are destined for 3 Canadian non-profit organizations. Their achievement is a testament to dedication, perseverance, and the power of individuals to make a significant positive impact. Completing one marathon is a considerable accomplishment for most. Completing 10 in such rapid succession across varied terrains and time zones is truly exceptional. This inspiring story provides a welcome counterpoint to more somber global news. It highlights the generosity and resilience found within communities, and the lengths to which people will go to support vital charitable work.